talk about the effects of weight training on the quality of life in recent breast cancer survivors. So this study is looking at weight training and how weight training helps improve the overall quality of life among recent breast cancer survivors, and we will dissect that as we go through. Okay. So, as you know, breast cancer is very bad, like all other cancers. Breast cancer affects many women. Over 200,000 women are diagnosed with breast cancer each year. And the main thing that happens is these women a lot of women don't get mammograms. So when they finally go and get their breast checked, get the mammograms, a lot of times it's already at stage 3 and stage 4 where it's fatal. So early stage breast cancer has a good prognosis. The 5-year survival rate is 88%. So again, getting the checks, making sure that you get your checks each year. Okay. Some of the issues with breast cancer survivors after they've overcame such a tremendous disease, a lot of things happen in terms of depression, sexual dysfunction, because for one, they might have had maybe they had a mastectomy. They don't feel good with themselves, and then their partner or whatever, they think that their partner doesn't look at them the same. Self-confidence goes out the window. They can't sleep because they're depressed. That's all they think about. Chronic fatigue, weight gain, and then again, ultimately, it impacts quality of life. And you're going to see this acronym here, QOL. So when you see that throughout the presentation, that is referring to quality of life. Okay. Now, it says here, the effects of breast cancer survivors on physiological and psychological benefits are unknown. So part of this study, what they wanted to do is see, does weight training help increase self-efficacy within these women and self-confidence? So we'll look at that. So with study design and participants, the study here was a 6-month study. It's a weight training for breast cancer survivors study. Okay. Well, they took 86 women, okay, that were recently breast cancer survivors. This was in the Minneapolis-St. Paul area. It took place from October 2001 until June 2002, okay. They were randomized, okay, in a controlled exercise study. And I'll get into what the studies were and how it was broken down here in just a second, okay. So they had a weight training intervention. What they did was, for the first 3 months, they either had an ACSM, which is the American College of Sports Medicine personal trainer, or from the National Strength and Conditioning Association, known as the NSCA. Okay, training was done in small groups of 4. They wanted to make it intimate. Okay, just from that whole social wellness piece, they wanted to make sure that these women were comfortable, that they worked out with some people so they weren't intimidated. The group did meet twice a week for the 13 weeks. Okay, and again, the goal was to teach safe and effective exercises so nobody got hurt. And there was, as part of the intervention, they did some pre and post assessments, and I'll get into those in just a minute. Mainly, they focused on 9 common exercises, looking at upper body, lower body, so chest, back, shoulders, legs, buttocks, hips, thighs, all those things. Also, the participants in this study did keep an exercise log. Also, they were supposed to go in and monitor, or again, writing what they did weekly. Now, if the personal trainer noticed that they only logged in once a week, then they would get a phone call and ask why they only came in once a week. So they were really on top of them to make sure that they were successful in their efforts. In terms of the measurements, they all did what is called a PARQ, Physical Activity Readiness Questionnaire. So they want to know, do you have a family history of heart disease? Do you have chest pain? Have you had cancer? I mean, basic questions. If you circle yes to any of those, you got to get clearance from your doctor. Okay, so part of this process, just to see if they qualified, they had to do a telephone eligibility screening, okay, to assess whether or not they could do it. Also, they had to get permission from their doctor, because remember, these were all breast cancer survivors, so they already had, an illness. They had cancer, so they couldn't just participate until they got clearance. So all 86 women did get the clearance, okay, and then they did measurements pre and post. Okay, so they looked at body fat percentage, they looked at BMI. They did waist circumference. They also did a 1 rep max, the amount of weight they can do one time. They did the bench press, and they also did the leg press. And part of their training, they did a combination of free weights and machines. And again, those trainers that I mentioned earlier were there to teach correct or give them good form. So again, quality of life, QOL outcomes, okay, were assessed by Cancer Rehabilitation Evaluation System, short form, so CARES SF is the acronym that they used, was designed to assess rehabilitation needs, okay, day-to-day problems of the cancer patients. They used a Likert scale on a 1 to 5 scale, 0 meaning not at all, 4 meaning very much in terms of where they were at. The other scale they used was depressive symptoms, Center for Epidemiological Studies depression scale known as CESD. Okay, and on this one there was 20 items, and they were scored on a 4-point scale, and the range was from 0 to 60. Okay, the survey itself was designed to measure the severity of the depression of the general population. As I mentioned earlier, these women, a lot of these women are depressed due to the fact that they did go through such a traumatic experience and things like that. In terms of statistical analysis, they used a t-test. Okay, so they looked at baseline characteristics of the population with the treatment and the control group, and then they also did the chi-square for categorical outcomes. Okay, as a result, 91% of the population, there's almost a 92% retention rate. Happy to announce 79 out of 86 participants did complete the trial, which is good. Okay, overall, the two groups were balanced. So, in terms of demographic, social backgrounds, energy, exercise, so they were all the same. Okay, they did note that there were changes in bench press. Okay, and also was correlated with the changes in their global score, and there was no association of changes in the CARES SF scores with changes in lean mass and leg press. So again, back to what I said at my earlier point is there's no research out there that shows that these changes have been made. In terms of the discussion, our results showed that weight training did benefit in terms of physical and psychosocial scores. Okay, did help with lean muscle mass and also upper body strength. Remember, they did do a 1 rep max. They were on a standard exercise prescription program. And conducting weight training twice a week did increase physical and psychosocial quality of life. Okay, that would having to do with body composition and strength. Again, when they went and did that post-test, post-fitness assessment, that's where they saw a lot of those. This is my source. This came from the American Cancer Society. Again, the name of this article is Effects of Weight Training on Quality of Life in Recent Breast Cancer Survivors.